Hello everyone, welcome back to my YouTube channel, The Disease Decoder. Today our topic of discussion is asthma. Um, let's start. Our first question is, what is asthma? Asthma is a chronic inflammatory disease of the airways and is characterized by increased airway hyperreactivity, reversible airflow obstruction, and bronchospasm. It leads to difficulty in breathing due to inflammation and constriction of the airways. I hope you understood what I'm saying. Now, let's talk about the types of asthma. There are four types of asthma: allergic asthma, non allergic asthma, exercise induced asthma, and occupational asthma. Allergic asthma, also known as extrinsic asthma, is triggered by allergens such as pollens, dust mites, or animal dander. Okay, non allergic asthma. Non-allergic asthma is triggered by factors other than allergens such as respiratory infections, exercise, cold air, or stress. Non-allergic asthma is also known as intrinsic asthma. Our third type is exercise-induced asthma, occurs during or after physical activity. As the name suggests, it is exercise-induced asthma. Our fourth type is occupational asthma, caused by exposure to irritants or allergens to in the workplace. Means you are working in an industrial area or in a coal mine. Uh, that's the reason of occupational asthma, because there are many pollutants there in the air. Now, talk about the risk factors of asthma. The first risk factor is genetics, family history of asthma. The second main cause is environmental exposure. Exposure to allergens, tobacco smoke, air pollution can induce asthma. Our third risk factor is respiratory infections. Viral infections during early childhood can cause asthma. Our fourth type common risk factor is obesity. Obesity is the most common contributing cause to asthma. Our fifth risk factor is occupational exposure to irritants or allergens in certain professions, as I mentioned earlier in occupational asthma. Let's talk about the pathophysiology of asthma. First step is inflammation. Chronic inflammation of the airways leads to increased mucus production and airway swelling. Like that. Airway swelling. Don't judge my drawing. I am very bad in drawing. Our second step is bronchoconstriction. Smooth muscle constriction around the airways causes narrowing and increased resistance to airflows. Okay, and our third process here is airways hyperreactivity. The airways become overly sensitive to various triggers, leading to exaggerated response. These are the causes of airway constriction that ultimately leads to asthma. Now let's talk about the symptoms. Here are the main symptoms in asthmatic patients. The first main symptom is wheezing. You may have a question in your mind: what is wheezing? Wheezing is high pitched whistling sound during breathing. Our second symptom is shortness of breath, means difficulty in breathing or feeling breathless. Third most common sign and symptom of asthma in asthmatic patient is persistent cough, often worse at night or early morning. Our fourth most common symptom is chest tightness. Sensation of tightness or pressure on the chest, means you are feeling heavy burden on your chest. And our fifth common symptom is increased mucus production, excessive mucus that may be thick and sticky. The last part of our video is about the management and contraindications. Uh, uh, we manage asthma. by certain medications. Here I talked about four most famous and important medications for asthmatic patients. First, we can use bronchodilators, means short-acting beta agonists for quick relief in asthmatic patients. Our second approach should be inhaled corticosteroids, reduce inflammation and prevent symptoms. Our third strategy should be long-acting beta agonists. Long-acting beta agonists can be used in combination with inhaled corticosteroids. Both can be used in combination for long-term control. Our fourth strategy should be leukotriene receptor blocker. Leukotriene receptor blockers help to reduce inflammation and bronchoconstriction. This is all about the management. Uh, what are the contraindications related to medications? Beta blockers. Beta blockers should be used with caution or avoided in asthmatic patients as they can worsen bronchospasm, and certain anesthetics, local anesthetics, can cause severity of the symptoms too. This is all about the asthma. We talked about what is asthma. It is an inflammatory disease of the airways. We talked about the types. I hope now you are watching it in proper way. Allergic asthma, non-allergic asthma, exercise-induced asthma, and occupational asthma. Then we talked about the risk factors like genetics, environmental exposure, respiratory infection, obesity, occupational exposure. Then we talked about the pathophysiology, what happens in asthmatic patients. uh, then we talked about the symptoms like wheezing, shortness of breath, coughing, usually during night or early morning, chest tightness, and increased mucus production. Then we talked about the management and contraindications. I hope you enjoyed the video. If you enjoyed the video, don't forget to like and share with your friends for the enhancement of clinical skills. Thank you.